It is my pleasure to host today in this Ask the Author session Dr. Yasaman Vali, who is the first author on the publication entitled Precision in Liver Diagnosis, Varied Accuracy Across Subgroups on the Need for Variable Thresholds in Diagnosis of MASLD. Dr. Yasaman Vali is working in Netherlands and is the first author. And first, congratulations for this paper to you and your co-authors. And I will begin by asking you, what is actually the context in which you developed this manuscript?
First of all, thank you so much for giving me the honor of being here today to discuss our newly published paper. Well, our study is about improving how we diagnose advanced fibrosis in patients with MASLD. So we already know that there are several non-invasive tests introduced in the market. They're being used by clinicians, and some of them are also being recommended in health guidelines. But there are variations in the reported performance of some of these tests that raise concerns about their reliability and potential impact on accurate diagnosis of this test. And in our study, we actually explored the variability in diagnostic accuracy of three of these non-invasive tests across different clinical subgroups of patients to see how well they perform and whether their accuracy changes depending on different patients' characteristics.
Good. That's relatively an important need in the field. So very important also is to tell us now what is the design, because effectively in which populations are you investigating these tests?
Well, that's a really good question, because this is the design of our study is a diagnostic accuracy study. And in that, we analyze data from the Litmus meta cohort, which is one of the largest NAFLD registry. We evaluated a large group of over 500 patients, actually, with biopsy-confirmed MASLD patients. This study aimed to see how accurately the three non-invasive tests, FIB4, enhanced liver fibrosis, called ELF, and FibroScan liver stiffness could detect advanced fibrosis across different patient subgroups. We looked at characteristics like BMI, sex, age, different levels of liver enzymes, as well as diabetic status of the patients, to assess how these factors might affect the performance of the test. And then based on that, we defined thresholds of each of the tests to detect advanced fibrosis at pre-specified, let's say, high sensitivity and specificity in each of the subgroups.
So what are the main results for what the listener should actually retain from this paper?
Yeah, well, we actually found very interesting results. We observed that the difference between the subgroups in terms of overall performance was very small and statistically not significant. That would indicate that the performance of all of the tests in detecting advanced fibrosis were compatible, irrespective of different clinical factors. However, when we evaluated the thresholds for pre-specified accuracy level, we found that different thresholds actually were needed to be selected to achieve the same sensitivity, the same specificity and predictive values in the respective subgroups. That was very interesting finding. For example, in the diabetic patients, we needed to select higher thresholds to achieve the same level of accuracy compared to those without diabetes. And that would actually highlight the fact that fixed thresholds could be misleading in diagnosis, and tailoring them to individual patient characteristics can make a big difference.
Well, I think this is absolutely a very important point, because effectively these tests were well known. There are cutoffs which have been published, and we apply this cutoff, regardless of the characteristics of the patients. But actually we are losing accuracy, as what you are telling us is that if we use a threshold which is adapted to the characteristics of the patients and to these populations, for example, diabetics, we can actually retain the diagnosis accuracy by adapting the threshold.
Exactly.
Is that a good summary of what you said?
That's definitely true.
Good. Very good. And so how you see that impacting actually the field? That will be, you think, implemented now it is out?
Yeah, well, you nicely summarized that how it can actually impact the clinical world, and I believe that it is this study is actually a very important step forward um, in improving how we diagnose measles. I think it shows that using a personalized approach instead of one size fits all, for example, can make these tests much more accurate. I think that, yeah, the world of medicine, the field of medicine is actually moving so quickly towards personalized treatment, but there hasn't been so much focus on personalized diagnosis. And that's something that I'm quite interested in. And I think that this kind of research, like the study we have done, would help to change this perspective. And by tailoring diagnostic thresholds, personalized diagnostic thresholds to patients' characteristics, we would be able to make diagnoses and managing measles more and more accurate and timely, and yeah, ultimately help clinicians to provide better diagnosing and better care for measles patients.
Fantastic. Yeah, this concept can apply to many diagnoses in medicine. So thank you very much for explaining it to us, and wishing you a good day.
Thank you so much.